Got it. Okay. All right. Well, y'all ready? Okay. Well, my name is Paige Can. I'm one of the nurses and certified diabetes care and education specialists here at the Diabetes and Nutrition Center at East Alabama. You'll also be hearing from Ashley Clay, and she will be taking over from me in just a few minutes to discuss some of the nutrition side of managing diabetes. But I'm going to kick it off with just some basic information about checking your blood sugar, which most people know how to do once they're initially diagnosed with diabetes. But just as a reminder, we want to talk about what we want your blood sugar numbers to be. I want to also touch on a few things about what some troubleshooting with checking your blood sugar with a glucometer, with a machine. And then I'm also going to talk about what to do if your blood sugar is too low or too high, particularly too low. I want to focus on that. So first and foremost, you hear a lot of things out there about what your blood sugar number should be, and you check your blood sugar and you look at this number on a machine and it may not mean too much to you. So we want to make sure we define what's normal and what's outside of normal. So we kind of have two numbers in mind when we think about too low and too high. Okay. So what we would like to have most of your blood sugars do is fall between the numbers of 70 on the low side and 180 on the high side. So when you see a number show up on this machine or something similar, when you check your blood sugar, we'd like it to be between 70 and 180. Okay, any number less than 70 is considered what we call hypoglycemic or too low. And I'm going to come back to that in a few minutes to tell you how to handle that. Any number above 180 is considered hyperglycemic or too high. So we'll talk about that in a few minutes too, and just what you can do about that. Okay. So that's what we're looking for. 70 to 180 is considered normal ranges for your blood sugar. Now, depending upon what time of day you're checking, we kind of want them in even more specific ranges than that. But that's something your doctor can discuss with you or your diabetes educator to decide what time of day may be best for you to check, and then what the number or the reading should be at that specific time of day. If you're generally looking at 70 to 180, you're usually in a pretty good spot there. Okay. So a couple things about checking your blood sugar, and I'm going to tilt the camera down a little bit so you can kind of see what I'm doing here with this machine. Okay. This is just one example of a glucometer or a blood glucose meter. All right. But a couple of things to remember, especially this time of year when things are starting to get a little chilly outside. These little test strips that you put your blood on like to be kept at a constant temperature. Okay, so that means leaving them in a really cold car in the middle of winter, and vice versa in the summer. Leaving them in a really hot car is really not the best idea. You could be getting an inaccurate result. Okay, so just something to keep in mind. These little test strips are kind of sensitive and they need to be babied a little bit. All right. They are a single use thing as well. So once you use it once, you have to discard it. So let me show you this particular machine, and most machines are very similar in that when you insert the strip, the machine is ready to use. In this case, in this machine, the strip goes in the top, but there are many where the strip goes in to the bottom, okay, down here at the bottom. But we're going to insert this in, and you'll notice it turns the machine on. After usually a beep or two, it'll give you a little picture that says that it's ready for your drop of blood to be applied, if you all can see that. Okay. The biggest and most important thing or most important mistake I see people make when they're applying their blood to this is that they stick their finger and they put the blood drop down on top of the strip. In reality, the best thing to do is take that drop of blood and come to the end of the strip so that the little line in the middle of the strip can soak up that drop of blood and make it a more accurate reading. Okay, so instead of touching to the top of the strip, you're going to touch to the end of the strip. Okay, can you see the difference between the two? And that will help soak up that blood and give you a reading, usually after about 5 seconds, nice and big across the screen. And again, those are the numbers we're looking for, hopefully to be somewhere between 70 and 180. Okay. So that's just basics of using the glucometer. The little device that comes with it to stick your finger to get the blood drop out is called a lancing device, and the needle that goes inside is called a lancet. Okay, so most lancing devices work similarly in that you pull back a portion of the device to get it ready to use. And that's when you put the device up to your finger and push the button that fires the lancet inside to stick your finger. If you notice, I'm kind of using the sides of my finger, okay, instead of right in the middle, because you have more nerves in the middle of your finger. So if you stick the middle of your finger, it just hurts a little worse. All right, so try to focus more on the sides of your finger. And the other tip that I'll give patients, especially this time of year when their hands are cold, is to wash your hands with some warm soap and water for like a minute before you check. That allows some circulation to get to your fingertips a little bit easier so that you're not having to push as hard against your finger with the needle to get the drop of blood out. So make sure your hands are good and warm before you check. Okay. On that note too, I like to tell patients you don't have to use alcohol to wipe your finger off, but it is important that you wash your hands. Every once in a while, we have a patient that calls very upset because they've checked their blood sugar and it's 520 and they've never had a blood sugar out of the 100s before and they're panicked and trying to figure out what's going on. And what we find out is that if they wash their hands well, recheck their blood sugar, it's normal. Okay, so sometimes things on our hands like leftover food from the last meal we ate, lotion, even hand sanitizer, all of those types of things can have an effect on that number. So just make sure your hands are clean with soap and water. Or if you do use hand sanitizer or alcohol, make sure they're dry. Okay, so that's just an important tip to remember. If you get a weird reading, always wash your hands and recheck first before you so you can confirm what's going on. Okay. Sound good with all of that, with lancing and devices and the monitors. And, we always are here at the Diabetes Center available to answer questions about how to use these devices and things too. And your pharmacist is a great resource as well. I always tell patients where you get your medicine, when you go to pick up your medicines and things, they can help you with devices like this too. So don't hesitate to ask if you have any questions. Okay.
Ashley, before we move away from the Lancers, are those, does each household, should they have, if they have multiple people who need to test their blood sugar, should they each have their own Lancer or?
Very good question. Ideally, yes. Okay. Because you don't want to be sharing the needle. It is going to be puncturing the skin. And so very good question. You do need to have one lancing device per patient. Or let me clarify, if you're going to use the same lancing device, you need to at least switch the needle each time someone uses it. Okay, because these devices you can remove the top and change the needle out. And in fact, I do recommend changing the needle out. Okay, if you are the only patient using this one lancing device, you can reuse that same needle maybe 3 or 4 times before you change it. But if multiple people in the house are needing to share the same device, then you do need to change the needle each time. Okay. So very good question. As far as getting rid of the needles when you're done with them, there is an Alabama state law that talks about how to dispose of needles properly in the trash. And basically, the easiest thing to remember is to grab an old laundry detergent bottle or even milk carton, a hard plastic container. And those needles, when they come out of this device, can go directly into the plastic container. When the plastic container is almost full, you can put the cap on it, put a piece of tape over the lid, and you can dispose of that in the trash. So you don't need to get a fancy disposal device or anything like that. Just use a plastic bottle you have on hand, tape the lid shut, throw it in the trash. Okay. So yeah, the person, one person, single use for this, a person can use the needle more than one time, but certainly changing the needle each time if someone is sharing it with you. As far as sharing a meter, it's easier not to, because it's very helpful for doctors to know that certain numbers belong to a certain person, right? Mm-hmm. I do have patients that like to share machines sometimes, but then it's hard for your healthcare provider to know if that 150 or the 300 was you or someone else. And so it is helpful to have different machines if possible. The good news is the machines themselves are not normally very expensive, and a lot of them are available for free from doctors' offices or from our clinic, or vouchers you can get online. So there's ways to get machines easily. Sometimes the test strips can be a little bit of a problem, but we're always happy to answer some questions about that here too, and how we can help you get the test strips to go with each of the machines. Okay.
So these machines normally keep a backlog of the patients, So that's really helpful for them to
They
be
do.
able to
It's
input
very
all.
helpful. They have them. All machines these days have a memory in them. They usually remember like at least 100 readings. A lot of them will be able to pull up averages as well for the doctors to look at and look at a 30 or a 60 or a 90-day average blood sugar. So all of that information can be very helpful. Yes. So you don't have to keep a separate written log with these machines. You certainly can. Some patients like to see on paper what they're doing, but these machines will remember those readings as well as the date and time if they're set correctly. So we can see all of that as well.
Okay.
Yeah, very good questions. Any other questions y'all can think of about that?
Not about the devices.
Okay, those were great ones. I mainly wanted to focus on the low and high blood sugars. And high blood sugars is a little more complicated than just this talk today. What I would basically tell patients is if you're noticing a trend where every day you're having numbers above that 180 range we talked about, then that's really just a discussion you need to have either with an educator if you see somebody at our clinic or with your doctor to try to figure out what they can do or what you can do to help get those numbers back in range. The biggest thing I tell patients is don't start taking an extra dose of medicine just because you think that may help. Okay, we need to have someone guiding you through that process and helping you understand the safe way to do that. Okay, so if you're seeing blood sugars above 180 regularly, let your doctor know. And then they can help decide if medicines need to be changed or if we need to start somewhere else. Okay. On the low side, though, it is a little more important that patients understand that you understand how to treat a low blood sugar at home and do it within a reasonable time frame because low blood sugars aren't good for our body either. That means our body is not getting the minimum of what it needs for your brain and your organs and everything to function like they should. So it's a problem we want to fix kind of quickly if we can. Okay. We follow what we call the rule of 15s, and that you don't have to remember that name, but you have to understand the idea. And basically the idea is if you start to have symptoms of a low blood sugar, and for most people, that looks like they start to tremble and get shaky and jittery. It also may mean you start sweating. You may get very cranky all of a sudden, very hungry, start having a bad headache or feeling very weak, like you can't stand up much anymore, okay? Any of those symptoms would mean that it would be time to check your blood sugar if you have your machine available to you. Okay. If you don't, if you're in the middle of Walmart or something and you have those symptoms, you may just have to assume, okay, I think my blood sugar is too low. But if you do have your machine, it's good to check so that you know if for sure your blood sugar is less than that 70 number we talked about. If it is, we want you to eat or drink something with about 15 grams of carbohydrates in that. Again, not something you have to know specifically. Let me give you some examples of what that may be. Okay, the first one is what's half a cup of any kind of fruit juice. Okay, so this is 4 ounces or half of a cup of juice or soda. Yes, thank you. Also looks like this, a small little juice box, a little individual juice box. Okay. These have about 15 grams of carbohydrates in them, okay, which should be enough to help a blood sugar come back up above 70. It could mean a little bit of regular soda too, like a Coke or a Sprite, not a zero, not a diet. At this point, we want it to actually have the sugar. We want it to be the regular Coke or the regular Sprite. And again, we would say about this much, which is about a half of a cup of the juice or soda. We try to tell patients, if you can, I know you may not feel very good, you feel shaky and you're ready to drink something, but try not to drink the whole bottle of Coke, okay? And Ashley's going to go over this, but this has a lot more than 15 grams of carbohydrates in it. So then sometimes we cause a worse problem, don't we? Because our blood sugar goes too high, okay? So we want to drink about a half of a cup of a juice or soda or a small handful of some candy, like, for example, a little mini pack of Skittles or 3 or 4 peppermint candies or lifesavers that you can chew up, okay? There's also something you can buy in the store. This is just one brand of what we call glucose tablets, okay? And they basically taste like a sweet tart. They're a flavored sugar tablet, and the bottle tells you exactly how many to chew, and it's usually 4 at a time, and that will give you the 15 grams you need, okay? So you get to kind of pick whether you want to choose juice, soda, candy, glucose tablets, but the idea is it needs to be one of these types of products that has what we call very simple carbohydrates in it that doesn't have to be digested in our stomach for a long time. Very simple sugars that start working very quickly. Okay. So after you eat or drink that, you want to wait about 15 minutes and go ahead and recheck your blood sugar at that point to make sure it's above 70. If it's not yet above 70, you may have to go back and do 15 more grams or 4 more glucose tablets or another half of a cup of the juice or soda to try to get it above 70 after that. Usually 1, at the most 2 treatments is all that's needed to get it back above 70. But you do want to recheck and make sure that you don't have to repeat it after the first time. Okay. The goal is to try to do it in stages, though, instead of, like I said, drinking or eating a whole bunch at one time and then causing blood sugar to go too high. We want just enough to fix the problem. That makes sense?
Yeah.
I always tell people too, though, if you are having more than 1 or 2 low blood sugars a week, okay, I mean, every once in a while it may just happen. You may go too long between eating or something happens. But if you're having them regularly, please let your doctor know. Don't just keep having those and having to deal with those. Something needs to be adjusted for you medication-wise or whatever it may be to try to help avoid those too. So that's something that would be worth a phone call to your doctor as well. We don't want you just having low blood sugar after low blood sugar and not being able to fix that. Okay. Any questions about low blood sugars?
Maybe it's not quite about like low blood sugar, but for those people who like don't have a diagnosis yet for diabetes, like what are some warning signs that they should be looking out for before they like get to these stages, and like earlier signs that they can be keeping an eye on?
Absolutely. Very good question. Well, and first of all, it's funny that you bring that up right after we discussed low blood sugar, because sometimes patients have some problems with low blood sugars before they're ever diagnosed with diabetes. So that would be something that I would tell you to look out for if you notice that you're having some problems with low blood sugars, but you've never been diagnosed with diabetes before. It may be worth seeing your doctor and looking a little further into that. It's what we call reactive hypoglycemia, and that can sometimes come before diabetes develops. Okay, so that's one thing to look for. Otherwise, some of the symptoms, diabetes is tricky. That's the thing, is a lot of times people get diagnosed and they had no clue they had diabetes because they weren't feeling any different. So that's why it's important to have regular checkups with a doctor somewhere, somehow, so they can catch it if it's an unsymptomatic case. But if you are looking for symptoms that people would have when their blood sugar gets higher, usually the things that patients report the most of are feeling very tired and run down. Like you finish your job, you go home from work, or you do a chore around the house and all you want to do is go lay down and take a nap. Okay. Which we have a lot of that anyway, right? That's just life, but very tired, not so much energy. And usually that's combined with some other symptoms like being extra thirsty. That's a big one. Like no matter how much water or fluid you drink, all you want to do is drink more because your mouth is dry and you need more. It also may mean because you're drinking more that you're doing what? Going to the bathroom more, right? So waking up multiple times a night to go to the bathroom, or just not being able to stay out of the bathroom during the day, okay? Blurry vision is another one people will report, meaning all of a sudden their prescription on their glasses doesn't seem to work anymore and they can't see what they used to be able to see. So those are kind of the main ones: low energy, thirst, more urination than normal, blurry vision, any types of, nagging symptoms like that would be worth just notifying your doctor so they could just run a glucose test. It's very simple to do, the test that can look at, whether those symptoms are related to your blood sugar or not. Okay. And especially if you have a family history, that's a big thing, especially with type 2 diabetes. So if you have a strong family history of diabetes and you have any of those symptoms, go ahead and get it checked out and just go ahead and rule it out, at least, if nothing else. Okay.
Okay. Thank you.
Yeah, no problem. Anything else about blood sugar? Yes, ma'am.
Yeah, I have a question. So, if you go to the doctor, last time I went to the doctor, she said my numbers were well because we did a full workup.
Mhm,
That have come up in there? Because I don't remember saying do a diabetes test for me.
I would say normally anytime they do any kind of basic lab work, they're going to include a basic chemistry profile and that includes a glucose level, which is a blood sugar level. I've never, it's one of the most common tests we can run. So I've never really seen a lab panel done that did not include that. Okay. Now there are some more, I don't want to say detailed, but some tests that dig a little deeper than just a random blood sugar level. One of those tests is called a hemoglobin A1C. So if you have a family history, it wouldn't hurt to talk to your doctor about maybe running a test like that A1C every so often, maybe once a year, just to see if it picks up on anything different than your random blood sugar test at that one point in time. Okay. So I think certainly, certain risk factors like that family history may be worthy of just a little bit additional lab work. And that's maybe not something they're running automatically, but you could ask for. Okay. I do feel pretty confident they are at least running a glucose level. But there are some more detailed tests that can help too. Okay. Because it's a huge thing with diabetes. If you can be very proactive and if you can catch it kind of in the earlier stages, it's usually much easier to kind of get a hold of. So taking doing some of those tests may be the way to do that, maybe the way to find it sooner. Okay. Y'all want to talk food for a little bit now? Okay, they're saying yes. Okay, well, I'm gonna turn it over to Ashley, and she's got a lot of food models here to show y'all. I'm gonna do my best to move our computer around a little bit so that you all can see. If you're having trouble seeing something that she's showing, let me know and we'll try to adjust. Okay.
Okay.
I don't think so. It should be okay. Hi, my name is Ashley. I am one of the dietitians here at the Diabetes and Nutrition Center, and I get the lovely food topic that some people get excited about and some people are not so excited about. I'll kind of talk about some of the misconceptions or, common things that people tell us when they're first diagnosed, like, I can't eat anything that tastes good. I can't eat any dessert. I can't, just lots of things like that. People come in with lots of questions. So we're going to kind of talk about some of those things. A lot of times people don't realize what food groups are carbohydrates. So that's kind of where I want to start, is showing you some little individual food models of things that actually are carbohydrates. And then we'll talk about how to build plates and things like that. So I'm going to start with some common ones. A lot of times when we ask people what foods are carbohydrates, they typically say these things. So they say bread, which is a carbohydrate. Okay. Here's a pancake. We're going to do a breakfast plate. Rice. So this is a small 15-gram serving of rice. And pasta. Okay. Those things are all carbohydrates too, but there are also other foods that are carbohydrates. So your milk and your yogurt are carbohydrates. Okay, now you probably can't see. This is just an individual yogurt cup. Those are carbohydrates. Here's some grapes. So fruits are carbohydrates. So grapes. Here's an apple. Paige talked about juice. We'll talk about that later. This is another common misconception. This is a banana. Half a banana is a carb serving. So if you eat an entire banana, you've had 2 carb servings. And in a minute, we'll kind of talk about how many carb servings per meal we need to have when we start making our plates. So we've established milk and yogurt are carbs, fruits are carbs, are common things like bread, rice, pasta are carbohydrates. We also have what we call starchy vegetables. So potatoes, this is kind of a small half a baked potato. These are some beans. An interesting fact about beans. So those long, skinny green beans are actually the only beans that are not carbohydrates. So all of your other ones, black beans, pinto beans, black-eyed peas, little small field peas. I feel like in the South, we have a million names for peas. Any kind of bean or pea that is not one of those long, skinny green beans is a carbohydrate. Here's some sweet potatoes. Here's some pinto beans, I believe. So those are carbohydrates as well. So typically we recommend that people have, another common thing people say is, I can't have any carbohydrates. So they'll come in and say, I've cut out all carbs or most carbs from my diet, which is not what we want to do. Okay. We need carbohydrates. We just kind of need to shift our focus from the normal carbohydrates we eat and drink, like sodas, cookies, candies. We need to choose more of the things I just mentioned and less of our processed carbohydrates too. So that brings me to one of the biggest things that is hard for people to wrap their head around and cut down on is what we call sugar sweetened beverages. So basically that's anything with sugar. So Paige mentioned we use juice to treat a low blood sugar because it brings our blood sugar up. So juice, regular sodas. Yes, a lot of times people say, I switched to light juice. That's a great lower sugar option, but it is still a sugary drink. So Starbucks is a big one. People don't realize how much sugar is in your Starbucks drinks. Okay, so that is kind of the biggest thing people have a problem with. So this, for instance, we've taken, I don't know how well you can see, we've taken a common soda, Coke, and the bottom of it, can you see that?
Yeah.
That's how much sugar is in a regular Coke. So if we're looking at the back, it's got 55 grams, which this has more carbs in this one soda than we recommend for one meal. Okay. That's just in what we're drinking. Okay. Sweet tea in the South, we like very sweet tea. Okay. So again, probably more sugar than this. Okay. This is a Fanta, which is another common one. I don't know if you can see that. Tons of sugar in that Fanta. Okay. This is a Starbucks drink. I don't exactly, it says a caramel frappuccino tall. There's 47 grams of carbs in this, which is also around the amount we recommend for an actual meal. Okay. Here's a orange juice, a Minute Maid orange juice. This is one of those light. This is Ocean Spray Light. So you see that it has a lot less than our, typical juice, but it's still a juice. So it still has sugar. So it still will raise your blood sugar, even if you drink the light juice. So what can we drink? Well, I always kind of tell people, we need to drink things that give something back to us. So water, obviously our body needs water. It's very good for us. A lot of people will say, well, I need something with some taste. I like to have some taste, to taste something when I eat. So this is an example. The dollar store has great brands and varieties also. This is just one of the boxes that we have on hand. These sugar-free packed flavor packets that you can add to water. There's a million different varieties. As long as they are 0 sugar, that's a great thing to add. We have a lot of high school age children or kids, teenagers that come in that are athletes that drink electrolyte replacements. So G2, any of your 0 sugar, your Coke Zero, your diet sodas, anything that says 0 or diet that has no sugar, it's not going to affect your blood sugar. And that's what we kind of want to do, is we want to get our carbohydrates from whole foods and not from our Starbucks and then eat our breakfast or, on top of the things like that. So I always recommend, if you have to drink something for breakfast, drink some milk, but you have to count that into your carbohydrates also, because it is a carbohydrate. So anybody have any questions about that basic stuff first?
Yeah. So I'm actually allergic to a lot of the artificial sweeteners that come for a lot of 0 sugar drinks. They like give me a headache immediately and make me feel like dull and like kind of out of it in my head.
Okay.
Do you have any recommendations for like an artificial sweetener kind of thing that's different than the normal aspartame type thing?
Well, the good thing about that is there's a million different kinds on the market. A lot of people are always asking us, what is a more natural artificial sweetener? What can I try? Monk fruit is one that people commonly use. It's kind of a more natural-ish, not aspartame kind of thing. There's stevia, truvia, all those different kinds. And, people always ask us which one is better. there's really not a gold standard as far as that goes. So I would, say for you or someone that has an allergy to, aspartame or things like that, to try to find a sweetener that you can tolerate, like maybe try a more natural one like monk fruit or something like that. And just kind of work your way through them to see which ones you can tolerate.
Okay. Thank you.
But as far as, sodas, most of them use aspartame for that. So that might be an option that you kind of just have to know, I can't really tolerate that. And, unfortunately, drink some coffee, get your caffeine instead.
Oh, so
Okay.
you can drink coffee. Okay. I
You
just wanted to
can.
get that in.
The only thing about coffee is like these Starbucks, they put like 10 pumps of sugar. If you just drink black coffee, or if you put coffee with your artificial sweetener, that's okay.
Okay, yay.
That's okay. Yeah.
Yeah.
Yes. Okay. So one of the other things that people tell us a lot of times when we're talking about our diabetes class is, I'm going to starve to death because I can't eat all these things. And then we go through the class and we build plates, and people, realize that they can eat a lot of food. They didn't know how to put it together, and it's, intimidating. So we're going to talk about some ways to build a sample breakfast, lunch, and dinner. We're also going to talk about some snacks as well. Okay, so like I said earlier, we typically recommend 2 to 3 carb choices per meal is what we typically recommend. And I'm going to show you a plate, and then I'll help you identify which foods are carbohydrates. Now, keep in mind, before we start, I forgot to say this. So there are foods such as proteins and fats that do not raise your blood sugar. So those don't affect your blood sugar. And there's non-starchy vegetables, which a lot of the sides, they're common sides that we have too, that we call non-starchy, which basically means they are minimal carbohydrates. So we recommend you eat a lot of those things and kind of, moderate your portion size of the starchy, carbohydrates that we have. Okay, so here is, I'm gonna tilt it down and kind of try to see. I don't know if you can see this. Can everybody see that?
Yeah.
So we have 2 eggs, we have an orange, we have a bowl of grits, we have some sausage and bacon, and then we have a piece of toast. So this plate, can anyone guess how many carbs is in this plate? How many carbs serving or foods that are carbs are on this plate?
116.
No. So there's actually 45
I was
on
way
here. So
off.
there's 3 carb choices on here, which is what we recommend. We recommend 2 to 3 carb choices per meal. So this orange is 1 carb serving. Okay. This piece of toast is 1 carb serving. Okay. And then this small little, probably half cup of grits is a carb serving. Okay. So your eggs, those are proteins. Your meats are proteins and fats. So these things do not raise our blood sugar. So that's just kind of a sample, and that's a pretty good little plate. So we're not gonna go hungry, trying to make sure we count carbohydrates. We just want to choose whole foods and less of our processed things that are so common for us these days. Okay, so that's a sample breakfast plate. Now we're gonna do a sample kind of lunch plate. Can y'all see that?
Yeah.
Okay, how many carb servings do you think are on this plate?
3.
3, that's right. So you have a serving of blackberries, so that's a carbohydrate. You have a cheeseburger here. So the carbohydrates are the bun. So 1/2 of the bun is 1 carb serving, the other half is another. So if you have a bun, that's 2 carb servings. Your cheese and your meat, those do not affect your blood sugar. That's protein and fat. Okay. And then we have a nice side salad here, which is made of those non-starchy vegetables. So none of the things in here are carbohydrates. Okay. So we can't eat cheeseburgers. We just have to count the bun. All right. So say we're going to go to a good old meat and 3 kind of place, and we're going to fix our plate. How many carb servings do you think is on this plate?
5.
So there's 3. Okay. there's your corn is one of those non-starchy starchy vegetables, excuse me. Your small dinner roll, or even like a small square of cornbread, that would be one. Your scoop of mashed potatoes, that's another one. And then your meat does not affect your blood sugar, so that's not a carbohydrate. And your broccoli and your carrots, those are some of those non-starchy vegetables. So these vegetables have a lot of fiber and other nutrients. Typically we tell people to try to get half your plate these non-starchy vegetables. And the other half you split between a good lean protein, like your meats, and then, a carbohydrate or two. Typically you want 2 to 3 carbohydrate choices per meal. Okay. So a lot of times people, and that's a pretty good size plate too. A lot of times people will say, well, what do I do if I'm still hungry after eating that plate? So typically what we recommend if someone is still hungry after eating your 2 to 3 carb servings is to go back for your protein or your non-starchy vegetables, okay? Because you're getting a lot of good nutrition from these non-starchy vegetables and this meat. So that's typically what we recommend to people when they say they're still hungry after having a plate like this, is to go back for that protein, those eggs if you're having breakfast, and some of your non-starchy veggies. Another easy thing to kind of do, if I always tell people to get a side salad if that's an option. So you get some of that good nutrition, some of those crunchy non-starchy veggies, and then you can not be really super hungry when you get your plate, and just we eat really quick when we're really hungry because we're hungry. So if you kind of savor a salad, you can kind of think about and kind of be more mindful and eat slowly and kind of think about what you're eating and what you should go back for. That kind of helps too. Before I go into snacks, another common thing is that people will say, oh, I didn't eat breakfast because I'm rushing out the door. And then, oh, I got busy at work and didn't eat lunch. And now I'm going to come home and I'm going to eat dinner. Okay. It is very important that you try to have 3 meals a day, at least, with those 2 to 3 carb servings per meal, because the goal is to give our body consistent amounts of carbohydrates so that our blood sugar is not going high and dropping, going high and dropping. So that's why, we recommend doing 3 small meals a day. And sometimes people need snacks in between, and that's okay. And we're going to talk about snacks, some snack ideas. We always like to tell people that when you have like a piece of fruit or something with some carbohydrates, that you have a protein with it to kind of give your body something else to digest instead of carbohydrates. Our body digests carbohydrates very quickly. So if we give it a protein and a fat, it kind of slows that hit of the carbohydrates on our blood sugar. So some examples would be, here's like a cut up apple, and here's a dollop of peanut butter. So an apple and some peanut butter would be a good idea for an in-between meal snack. Or, a lot of people like to do crackers, something light. So here's, some graham crackers and another dollop of peanut butter. That gives you that protein and that fat. A lot of people will just reach for these because they're quick and easy, but your body also digests these very quickly, and you're hungry within an hour or so after that. But if you give your body some fat and some protein to go with that, it helps hold you over a little bit longer than just the carbohydrates. Another example would be like a cheese stick and some, here's like little Ritz crackers, or the little cheese squares. That's another good thing to do. That's, or you could do, here's a bowl of strawberries, some strawberries and a handful of nuts. Be careful with the nuts because it only takes a little to get, lots of calories. So a small handful of nuts would be sufficient to go with some fruit. 2, sometimes people, prefer to, they have to do breakfast in the car. So they prefer to, drink something quick. We're not sponsored by Fairlife. This is just some of the things we have in the office, but this is one of those. Fairlife, it's got a good 30-gram protein, shake, it has 3 grams of carbohydrates in here. So not very many carbohydrates and lots of protein. So maybe you had half a banana and one of these, or a whole banana and one of these for breakfast. You can eat that in the car. This is another one of those. This is a Boost glucose control. It's a carb steady shake. It would be good for something quick in a bind, for a carbohydrate as well. Greek yogurt. I feel like people get tired of me saying that, but it's a good carb to protein ratio. So it's, you get 10 to 15 grams of protein with 1 carb serving. So it's a great in between meal snack to kind of hold you over, give you some good protein. Now, desserts. We always show these and everybody gets excited in the class because we're showing them ice cream and cookies and stuff. So say you were gonna have this dinner, okay? And you're like, I'm gonna have a brownie. So one thing you can do instead of eating that roll, so I took the roll away, you have your brownie. So you still have your corn, your brownie, and your mashed potatoes. So you're still getting your 3 carbohydrates for this meal, but you're just planning ahead and putting that brownie. You're gonna have that brownie. A lot of times we're tempted to have our brownies and our ice cream and our things like that late night or before bed, which is not what we need to have them. But it's good to incorporate them into your meals so that you feel like you can have them, because you can. You just need to not eat as many carbohydrates in your meal. So small brownie, a little scoop of ice cream. You can see that ice cream. There's chocolate. This is one of those small like cake donuts. And this is a small little cookie. So we can have treats and things. It's just, we need to try to have more of the whole foods, like your fruits, your starchy veggies, your milk, your things that give us good nutrition instead of our treats all the time. But we can't have treats. We just have to incorporate that into our day. So, anybody have questions about any of that?
So, you spoke a lot for the carbohydrates. And I know before this all started, I'd asked you that question about the difference between like the glucose and sucrose. Does that have any noticeable effect on if you're partaking in one or the other on your blood sugar level / overall health?
No, so typically we tell people, sugar is sugar, and that goes back to the goal in helping control blood sugar is trying to control, getting a steady stream of carbohydrates. So, a lot of times when people mention sugar, when we're teaching them, we teach them to look at the total carbohydrate of the food, because that is included, the sugar is included in that number, and that's how we can help easier manage how many carbohydrates that we're having. That sugar is accounted for in that total carbohydrate number on the back of your nutrition label. So I'll read you one, for example. Let's see. Like this soda right here. I know you can't see that, but it says total carbohydrates is 55 grams. Right underneath it, it says sugars, which also says 55 grams. So we teach people to look at the total carbohydrate number. It is bold on a nutrition label, and the sugar and the dietary fiber and the added sugars are non-bold. So what that tells you is that those non-bold items are all included in this total carbohydrate number. So, we tell people, sugar is not the main thing that we're looking at. The main thing that we're looking at to help with our blood sugar control is carbohydrate amount. Okay. So that's why we tell people to stay within that 2 to 3 carb serving per meal, or that 30 to 45 gram carbohydrate number per meal, and not look at the sugar, because that's confusing. It's just another extra thing to look at. It's a very common thing that people say, well, I looked at the sugar, or I got this says low sugar, I picked it because it says low sugar, but it may or not be low carbohydrate, which is really what we're trying to watch.
Okay. Given the like issues that you've run into with people like misreading or misinterpreting the nutrition label, and we see that as an issue, especially with like adults with illiteracy levels,
Mhm.
do you I don't, have you ever heard of like if the nutrition labels might change the way that they look or anything like that to make it less intimidating or like more easily understood or
Well, they have changed. As far as in the future, will they change? I'm not really sure. I think they've tried to make it less intimidating by bolding things that are commonly looked at, like your calories, your total fat, your cholesterol, sodium, potassium. Those are common things that people look at when they're looking at a nutrition label.
Mhm.
But as far as, I don't know if there is a way to make it less confusing or intimidating when we do our classes. When we print out a nutrition label and we go ahead and make lines and draw lines through things that we know, we tell people just don't even look at that. We kind of explain what it is, but there's a lot of things on here like your percent daily value. That's not a number that you need to look at. That's based on a 2,000 calorie a day diet, which someone may or may not need because everyone is individual. So, those percentages on the side, you don't even need to look at those. Really what we tell people to really look at is the serving size, because like for a ready rice side or like a box pasta, there may be four servings in that one box, but a lot of people eat the whole thing thinking it's one serving. So we always tell people to look at the serving size, because say this cereal, a serving size is 1 cup. So for 1 cup of this cereal, that's what their nutrition information is for just 1 cup.
Yeah.
So that's another thing we try to reiterate to people. So as far as it being easier, I'm not really sure how they could change it or if they will change it to make it easier. I know they try to make it easier and less intimidating for people, but I don't know if they'll change it in the future to be less intimidating. But we try to take some of that intimidation out, because there's a lot of numbers on there that people just don't really need to look at.
Yeah. And before we wrap up and everything, if people had any more questions or wanted to get more information about this stuff from y'all, is there a easy way that they could contact you?
Yeah, you could always call the office. Our number is 334-528-6800. And whoever answers the phone can typically steer people in the right direction for that. If they had a more specific question, we could.
Yeah, that's what I was gonna say. Certainly to answer any questions that you can ask when you call that number to ask to speak to an educator, and if we're not available right then, we'll be happy to call you back. If you wanted to come and sit down and meet with us in person, anyone, we'd be happy to do that. We do have to have a doctor's referral to see you, but the very large majority of providers in our area know about us and know how to reach us and how to send that referral. So just simply asking your physician, your nurse practitioner, whomever you see, for a referral to the diabetes center, they can initiate that process, and then we can call you to get an appointment scheduled. So certainly we're happy to meet in person, and generally insurance covers visits in some way, shape, or form related to diabetes, and we can discuss that further when we call you. So okay.
Well, thank you both so much for giving us your time and speaking to us today.
Absolutely. Very hope it helpful, and just let us know, if we can help you in the future.
Yeah, will do. Thank you all.
Yes, thank you.
Thank you so much.